Okay, thank you very much. My name is Michael Tendo, and I'm the CEO at Mage Health. What we do is we're trying to build the infrastructure to enable exchange of healthcare information, because as you all know, the bedrock on which machine learning sits is data. So in the case of healthcare, electronic medical records are crucial to make machine learning work um, in order to build all the applications that we're going to discuss today. So what we're doing is to make sure that we can enable sharing of medical records while patients are still in control and while we still follow the necessary regulations. So if you can hear me clearly, just confirm with a comment and then I'll start my presentation, which will be about the applications and challenges of machine learning in healthcare. So, okay. Yes, thank you very much for this opportunity. And the presentation will be mainly in two themes. First, the applications and also the challenges that we face. So the applications will be talking about the current uses that are being implemented and also the potential applications or the possibilities that may not be currently in use. And then also we'll talk about the challenges and how we can fix them, basically why we don't have these in all the hospitals yet. And that'll be it. So to start off, the applications, we're going to split them into three sections. Clinical practice is basically what happens when you go to the hospital today to see the doctor. Years before you visit the hospital, basically the scientists in the lab and how machine learning is helping them in their work to build drugs and to study the spread of diseases, basically to prevent what the disease, that the patient ever getting the disease in the first place, or to figure out how to treat them when they do. And then analytics will be looking at how we can use the electronic medical records that we already have in order to make the environment safer and in order to identify ways to prevent the spread of disease. So we'll start with the applications in clinical practice, and one of the applications is in diagnosis. So with the electronic health records that we've gathered for, I guess, decades now, all that data that we have, we can use it to identify the best path forward when we identify the symptoms. For example, you walk into the hospital today, identifying what specific drug will be most effective to you might be as simple as the major symptoms. For example, with several diseases, say right now, since it's winter, it's kind of flu season. So some symptoms may not need a doctor to determine that this person should take an influenza test, and if it's positive, then we should give them this type of medication. So in order to fix the shortage of labor and the high rising costs of labor in the healthcare industry, we could use machine learning models to do the triage or the preliminary analysis in order to determine the best path forward before we have this reviewed by an actual doctor. So the other application is in medical imaging. And as you know, there's many ways, many types of scans, CT scans, MRIs, X-rays, and these are used to diagnose diseases. For example, cancer, brain tumors are diagnosed in MRIs. some of the diagnoses are literally just using images, looking with normal light. For example, skin cancer, melanomas are very common ways of identifying skin cancer in its earliest stages. So it has already been proven that AI is much better even than human doctors at reading these medical images. For example, with breast cancer, Google developed a model that identified 97% of the cases from mammograms. And then there's another model that was published that identified 95% of melanomas, which is the earliest stage of skin cancer. So this literally solves our labor shortage with the medical industry, because there's always going to be higher demand for labor in the medical industry than supply, because, well, being a doctor is not an easy career to accomplish. So we're always going to need more doctors than we can actually provide. So these models can slowly start to substitute in for human doctors, and this solves our problem. So the other application is precision medicine, and this is a relatively new field of research where you go to a lab, and they take a sample of your DNA and they analyze your genes. So genes usually have certain biomarkers which identify how susceptible you are to certain conditions, and sometimes how certain drugs might be effective on you. So using that genetic analysis, they can choose what drug would be best to prescribe for you. And this might not sound like a big problem when you think about normal diseases like the common cold, but with diseases like cancer, you can't afford to pick a treatment and then switch later, because it's literally going through hell with treatments like chemotherapy. It's going to be terrible for you to go through that, and then you discover that you didn't the treatment is not working, and then you have to switch a treatment after you've lost all your hair and your immune system is failing. So choosing which treatment to apply, this is common even with HIV. Basically, diseases that affect the immune system, it's very crucial. And using genetic analysis with AI, we can use those biomarkers to determine what's the best drug to prescribe for a specific patient. So we'll now look at some of the applications in research. And in research, I believe the most commonly known application is with drug discovery. Very recently, with the development of the COVID vaccine, it's known that vaccines have usually taken almost 10 years to develop, but the COVID vaccine was done in less than 2 years. And this was because how vaccines work is they have to train the immune system to fight the virus. So they develop a drug which is going to bind to proteins on the surface of the virus, such that the immune system can recognize the weak points of the virus to destroy it. So this means that they have to understand the structure of the virus, which viruses are very, very small, very, very, very tiny. I can't emphasize how small they are. So it's very hard. They can't just look at them under a microscope. It takes a very, very long amount of time to understand the protein structure of the virus. So with machine learning, they use the parts that had been recognized so far in research in the lab, but that had been around maybe 10% in the short time that they had that. And then they predicted the structure of the virus or the possible structures of the virus, and then use that information to go and develop a drug without waiting for the chemists in the lab to build the full structure. So this sped up the process tremendously. And that's how we have the vaccine after just 2 years. The other application is with epidemiology, and this is from epidemics, the spread of diseases in the environment. So just like with COVID, They had to figure out what measures are going to work best with stopping the spread of the disease. And how they model this is using computer simulations with the normal rate of spread that they've measured through different points of contact, and then they simulate that over multiple patients, and then they try to anticipate how far the disease is going to spread in how fast, and what interventions are going to work best to stop that spread. So this, again, we can't find a better example than the recent outbreak of COVID, and it has helped a lot. That's how they got to know that we should use this, we should do this, and this is the percentage in the reduction of spread that is going to be caused by this particular intervention. So the other application that we've talked about, because of the fact that we have the electronic health data that we've collected over the past maybe 2 decades that we've had computers and we've been collecting data, we can now use that data to analyze patterns in the clinical notes that are provided by doctors, the diagnosis and the relevant prescriptions that were provided, to sort of have that autopilot feature onto the diagnosis process. So we can start with some of the applications that we can derive from health data, and one of them is with insurance pricing, because if you look at insurance at its core, it's basically people coming together to share the risks of certain diseases. So they have to set a single price for everyone, but some people will not need that insurance and they will end up paying for other people who will get sick, and but it's a zero-sum game. So all that money has to come from someone and then pays for someone. But that's kind of unfair when you think about it, because some people, it's already clear that their genetics or maybe their environmental factors do not result in high risk of certain diseases. So they should be actually paying less. So that's one of the things that we're doing. When you share your medical data, we can customize your insurance quote so you can get a cheaper price on your insurance. And this is better. It reduces the costs for both the insurers and and the patients, because when the insurers can calculate who will need the insurance and who will not need the insurance, most likely, then they can raise the prices for the people who are at a higher risk and then lower the prices. So it means that it's easier to market the product, the insurance product, because everyone will come and get the quote that they deserve, and they'll be happy with the result, rather than everyone going around saying, oh, insurance is fraud and everything. And then on the side of the patients, well, they're just happy that they got a quote that they deserve, right? And another application is with public health, and this is with maybe designing health policies, and maybe the government trying to identify where to build hospitals, where to set up the infrastructure for say facilities to reduce pollution, or generally public policy problems. This can be analyzed by following the patterns of spread of disease to do some root cause analysis to figure out what's the best intervention to stop certain patterns in health problems. So an example, again, would go back to epidemics. So when there's an epidemic, the rate of spread can determine how fast they need to respond to curb the spread. Or so how big of an area, for example, do they have to quarantine based on the time from which the first case was reported. They can do a model to estimate what's the geographical blast zone, so to speak, and they can do a quarantine of only the people that are required. So this is more of an application in government and public policy problems. Another very common application that we must be familiar with now is now that there's a perpetual use of fitness products, everyone has a computer on their wrist always, collecting information about the fitness data throughout the day, and that's valuable information. But it turns out to also provide critical information that could save a life. Very well popularized by Apple Watch and Google Pixel. They were all doing a lot of marketing about car crash detection, which is pretty funny because someone would ask, why would I need to know if I'm in a crash? It's pretty obvious if I am. But the selling point is you may not be able to make a call and then the device makes the call for you. So, well, that's something. And another event is a heart attack. And like again, like we said, because these devices are perpetually collecting information, it's easier for them to identify some odd patterns in breathing, in heart rate, and then they can call the relevant, maybe an ambulance or something similar. So yeah, that's something. And many other applications actually can come from fitness data because of the fact that it monitors things like blood oxygen and what it has a lot of insights about, say, ovulation, or basically any information about weight improvement can be derived by advising you on which diet to follow, what percentage of body fat, and these are all usually estimates. Like an example is the heart rate itself. It's not that the sensor has some kind of stethoscope in it. It's literally just a camera and a flashlight. So it's using computer vision to study the patterns in the flow of the shades of red to know how many times blood is being pumped across. So yeah, that's an application of machine learning in itself, because computer vision is based on neural networks. So that's something. So one of the challenges that we have, the reasons why some of these things are not yet in application is, first of all, data availability and quality. So this data is very, very hard to get. And even when you do, usually it has missing values, or because of the fact that, well, hospitals are not technology companies. So they would not have taken great care about ensuring that the data is consistent. So this is a big problem, and of course, it's not easy to solve. But first of all, one of the solutions that we can have is to have because this leaves a vacuum for innovators, normal technology companies to intervene and build that infrastructure. A perfect example would be when banks used to do checks and all that manual paperwork to move money. And banks, as banks, were very comfortable because they were profitable enterprises. So they weren't going to come around and find a way to invent this thing called fintech, right? There needed to come a new cohort of companies, technology companies, that would build these solutions, and then the banks would just adopt them. So it's the same thing now with hospitals, because data is kind of the currency of 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 machine learning, right? So it's similar to how money was literally the currency of the economy and its flow had to be digitized. Same thing now, to move from just collecting that data and keeping it to actually using it. The regulations, first of all, have to be in place to ensure that patients are still in control of how their data is shared, and then technology companies have to build the infrastructure of managing this data flow, which is what we do. So the other problem is bias and fairness. And a glaring example of this would be clinical trials. Up to now, it's only less than 10% of clinical trials that involve Africans. So this means that the drugs we take literally haven't been tested on our physiology or how we would react, basically our because our physiology is different because of the environment that we grow in, right? So it's not just about the drug, but also the textbooks that the doctors will read in the university will have diagnostic procedures that are very different from reality, right? An example was when I went to the dermatologist at some point and I had a certain rash. So its name was, it literally had the word red in it. So for the doctor to diagnose me with that specific condition, they had to know, they had to see red rash. But on black skin, you can't, black skin, when you get a rash, it's not red, it's just black, right? It's just other types of skin types which usually have red rash. So this sort of exclusion of certain demographics is reflecting in these ML models, and it's going to be a very big problem if it's not taken care of. So it's something that just needs to, we just need to build standards of data quality, and we need a bit more research in and develop some metrics of analyzing bias in data and making sure that the data sets that are used to train these models are very representative of reality. So another concern is with privacy and security. And this, the only way out of this is with regulation. So we need the governments, the respective governments, to come up with data protection laws to ensure that the hospitals or maybe technology companies that are in charge of this data are using it with their consent, are using it for purposes well within the law. And yeah, just it's as easy as the government getting involved. And this is something that is very crucial, because electronic health data in particular is very, very sensitive data. And an example would be with how social media data has caused a lot of rage about people saying that companies are spying on them. But frankly, that was just social media data. Now you can imagine how enraged people would be if technology companies started sharing, say, their fitness data, which could represent a lot about their mood, and generally infer a lot about whatever is going on in their life. So yeah, that's pretty much it. Thank you very much for listening. I'll be ready to answer some questions now. Yes, I noticed someone asked about insurance pricing based on previous patient records. I would like to mention that this is dependent on access to the patient's history. So yes, what needs to happen then is the patient has to consent to sharing their medical records, and that's what we're working on. We want to build a central database for what someone's medical records. So when they sign up, they request their records from all the hospitals, because it's your constitutional right to request your medical records from any hospital you've ever visited, and they have to provide them, right? But no one is going to go around knocking on hospitals' doors asking for their records, right? So that's the solution we want to build to help you get control of your records. And then when you do, what do you use them for, right? Why would you even want them? First is you're going to get a lower quote on insurance. So if you consent to sharing your records with the with us, really, not directly with the insurance company. So we calculate an insurance score, which then we send to the insurance company, and the insurance company will give you a cheaper quote, kind of like how loans work. And most of the analogies that I'll make here will be very similar to the finance industry, because the finance industry has integrated with technology very, very deeply, right? The relationship is 20 years old, literally, right? Because the first e-commerce transaction happened before 2000, right? So this particular problem of data access and control is kind of being ignored in the healthcare industry, because healthcare data is very sensitive, but ignoring it doesn't fix the problem. It still remains that hospitals, which are not tech savvy or even very, very conscious of what responsibility they hold, are still controlling large amounts of data, right? Some of them are not even cybersecurity aware enough to protect this data. So we just need to stand up and face this problem and fix it. And then afterwards, it will be easy to trust, say, an insurance company when they request access to your health records. They don't actually get access to your records. We get access to the records and calculate an insurance score, like a credit score, just a number that we provide to the insurance company, and then they give you a better quote. So how do insurance companies have access to client records that would enable them to price health insurance based on individuals? Yes, this is with their consent. So the patient, with the interest of getting a cheaper quote, shares their records. Oh yeah, you're welcome. Thank you very much. Any more questions? Yes, we often hear cases of negative health conditions that do not show any symptoms until it gets to a very critical state. This is very similar to the problem I mentioned.
Yeah, more questions are on the way. So more questions are on the way.
Okay, thank you. So because of the fact that clinical trials are very, very, very biased data sets, so pharmaceutical industries will release drugs because the FDA, that's the authority in the US, has approved them. But that does not mean that we have done enough research and clinical trials in Uganda, for example. So when we train our doctors on these textbooks that have been written that by people who have only done clinical trials on a specific demographic, there will be very limited, that tunnel vision will be focused on that specific demographic, and it will actually hinder the diagnosis. So you go to a hospital and they will still not diagnose you for that specific condition that you have until it's too late, right? Because the textbook said it has to be a red rash, right? But on you it's a black rash, because I've literally never seen a black person with a red rash ever, right? So the issue really is to be addressed in the same way that bias is. And I've seen a number of companies that are doing it. There's a company here in Dubai called Nabta Health, and what they're trying to do is to include more women and Black people in clinical trials to try and balance those data sets. But it's not an easy problem to overcome, really. So how can AI help detect these health conditions early enough? So diagnosis in general is really broad, right? But it depends on the conditions. So we can use AI to determine the best path forward or the next point of care. So an example would be we can use AI to recommend what test to make, right? But until you test positive for a certain condition, we can't base off of just symptoms to give a prescription. But we can use AI, especially because of the fact that there's a huge shortage in for medical practitioners. We can use AI to determine the next path forward. So this would mean that instead of consulting with a doctor, you just go straight to the lab and take a test, and if you're positive, then you get the prescription. So AI performs very, very well in providing a prescription after a test has been made, because that's literally just a one-to-one mapping in most cases, right? But confirmation without a test is still not possible. And I'm not saying that it substitutes human doctors yet, but it sort of shortens your visit to the hospital. Yes, I hope I've answered that. Hope I've answered that.
Okay. Yeah, thank you very much, Michael. We really appreciate your time. Your
You will.
presentation was quite lovely, interesting, and quite detailed. We now understand how machine learning can be applied in the healthcare sector, and we hope to build different solutions to actually, solve complex problems in terms of healthcare here in Nigeria and Africa. So I really appreciate your time, and I'll move on to the next speaker. Thank you, Michael. Thank you.
Okay.
So,
Okay.
what's the next speaker for this conference? She she also one of us at Buffett. She currently works at the business transformation and as a mother. And name is Ms. Faith Ajiboye, Femi Ajiboye. And she will be speaking to us on how we can use